Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
which of the following antihypertensives do not have central action? Methyl-dopa, clonidine, and also propranolol have central actions, whereas prazosin has no central action. A diabetic patient with bilateral renal artery stenosis requires a drug for the treatment of his blood pressure. Which of the following is the most appropriate for this patient? So he is renal artery stenosis, so ACE inhibitors are contraindicated. Whereas diabetes mellitus, so thiazides and also beta blockers are avoided. So obviously in this we can give amlodipine is given. Next, treating hypertension chronically. When treating hypertension chronically, orthostatic hypotension is maximum in guanethidine. Guanethidine is an alpha blocker. So as a result, it causes maximum orthostatic hypotension.
thank you and thank you for watching.